Hey everyone, my name's Lauren Steffen, and I'm going to talk to you today about the goals and objectives set by Healthy People 2030. As we've learned throughout this semester, Healthy People 2030 developed multiple objectives for a lot of our healthcare concerns. It ranges from mental health to diabetes to renal complications and finally heart disease, which is what I want to talk to you about today. For anyone working in healthcare, we know that a lot of our patients have heart disease. It's treated inpatient, it's treated outpatient. A lot of the people we care for have heart disease. But it's still one of the top 10 leading causes of death in the United States, according to the CDC in 2018. And I think what people don't understand is heart disease isn't just a heart attack that puts you in the hospital. It includes the pathological processes such as coronary artery disease, which can lead to a heart attack, but it also includes things such as congestive heart failure, cardiac arrhythmias, those arrhythmias needing to have a pacemaker or defibrillator to control it. Those are all things that we need to consider when diagnosing and treating heart disease. And my Healthy People 2030 objective is to increase the proportion of adult heart attack survivors who are referred to a cardiac rehabilitation program. Healthy People 2030 has this objective listed as being in the developmental stage. So what does that mean? That means that it is a high priority public health issue. It has evidence-based resources and interventions, but there's really not any baseline data yet. So they are working to compile all of the data to get a good baseline. One thing I did find in everything was that only 20% of the patients who are eligible to participate in a cardiac rehab program are actually using it. So I wanted to know why. Why are only 20% of the population using it? Turns out there's a lack of referrals. Unfortunately, you do need a physician referral to attend a cardiac rehab program, but a lot of people don't know about it or what cardiac rehab has to offer to these patients. First and foremost, we have to understand what cardiac rehab really is. The Million Hearts Initiative that Healthy People 2030 uses as their evidence-based resource defines cardiac rehab as a comprehensive secondary prevention program. It is designed to improve cardiovascular health after a cardiac-related event. The American Heart Association adds on to it that it is medically supervised and includes those who have a heart attack, heart failure, angioplasty, or any cardiac surgery or procedures. While the AHA, American Heart Association, notes that it is a 36-hour program, it cannot change the past and you can't necessarily undo the damage from your heart disease. You can assist with a healthier future. The great thing about cardiac rehab is it's pretty customizable to suit the patient's needs. So we talked a little bit about the lack of referrals. Contributing to the lack of referrals is not understanding who really is eligible for cardiac rehab. I've found that there's a false pretense in our community that you have to have open heart surgery to utilize the services the cardiac rehab provides. It isn't the case. In the Youngstown market, the open heart surgery patients are all referred to cardiac rehab upon discharge. But it's important to consider that they don't necessarily have to have surgery to participate in the program. Those patients that have had a heart attack, obviously, are welcome. But having a heart attack doesn't mean that you had open heart surgery. You can participate in cardiac rehab after you've had a cardiac catheterization, if you've had a stent placed, if you have congestive heart failure, your heart isn't pumping effectively, if you have low ventricular function, including if you had to have a pacemaker or defibrillator placed. Those actions require modifications, and cardiac rehab can definitely help with that. Patients that experience chronic angina have to learn to alter their current regimen and activities to not exacerbate their problems. So, let's talk. So now that we know that patients aren't being referred, how do we actually increase their participation in cardiac rehab programs? What do we have to do to initiate referrals from the physicians or the providers? As I said, the healthcare providers aren't necessarily aware of who is eligible to refer to a cardiac rehab. They often aren't aware that their patients with things like congestive heart failure are able to participate. And unfortunately, in healthcare today, our providers aren't allotted a lot of time with their patients to have these discussions, and for things often do get overlooked. There's not really a distinguished referral process. There isn't something that says, well, if you're diagnosed with X, Y, and Z, you qualify for this. So that's something that we need to consider. Personal barriers that patients have to not participating in a cardiac rehab program, the main one that they talk about is cost. Yes, insurance does typically pay for cardiac rehab, but copays can still be really high, and that is an issue for some people. Transportation is an issue for a lot of patients getting to and from, if they're in an assisted living or skilled nursing facility. Transportation can be difficult after any cardiac event, but particularly after open heart surgery. You aren't allowed to drive for 8 weeks, so you have to have transportation set up. A lot of people are not able to complete the program because of work or home obligations, or just general lack of support from their family. We need to improve on that. So how do we do it? Education. It is always education. We have to teach our providers about the cardiac rehab program. We have to talk to them about who's eligible, when do they qualify, what can we do to make it better. And the patients need to understand the benefits that cardiac rehab has to offer them. If it's going to be beneficial to you, you should be able to utilize the resources. So starting with provider education, there's so much that we're able to do preventatively. It starts when you're younger and works its way up. Encouraging participation in the heart walks that the American Heart Association has. Those are national. They're constant. They're everywhere. They're great resources. You can participate, you get your exercise in, you meet a lot of people, which gets you a great support system. Visiting with your primary doctor, you can manage your hypertension, which will lower your risk of cardiovascular complications. Participating in screenings. Our providers really need to understand the importance of that to encourage people to live a healthier lifestyle. They need to understand how to refer people. What can they do from their end to encourage people to attend programs? And the patients need education too. So they need to understand that the preventative appointments are for them, and that they need to take care of their hypertension and make dietary modifications if there's a concern for heart disease. They need to understand that it's not going to go away. You have to take care of it. So some questions that are brought up in these appointments with their providers is, what is cardiac rehab? Why do I need it? Do I have to have surgery to qualify? When does this program start? There's a lot of information that patients need to understand, and it has to be relayed appropriately. So the first and foremost thing is, what is cardiac rehab? Cardiac rehab is a 2 to 3 phase program that phase 1 includes when you're in the hospital after a cardiac event. So during this time, the cardiac rehab staff, the exercise physiologists, are going to meet with the patient. They're going to discuss the entire program, what they expect from them, and what the patient should expect from cardiac rehab. During this time after open heart surgery, typically the patients are encouraged to practice sit-to-stand maneuvers and ambulating and watching everything they do, because surgical patients have restrictions. For example, open heart patients are not allowed to lift more than 5 pounds. They're not allowed to drive for 8 weeks. They aren't allowed to push and pull, and they're not allowed to use their arms to stand up. They have to hold a pillow to their chest to keep the sutures from opening. So phase 1 really focuses on the basics. They want to get you up and moving. They're going to watch your heart rhythm, your heart rate, your blood pressure, your pulse ox, to determine if you need any oxygen. What can we do to make you the safest? And then the patient is discharged home, and this is when phase 1.5 begins. It is the beginning of the cardiac rehab outpatient process, but the cardiac rehab staff will go to your home after you've been home for a couple days. They will work with the patients to determine the best ways to gain endurance and participate in their daily activities. The goal of this step is to just do a little bit more than you did the day before. So if you walked 20 feet, today we're going to try and add in some stairs. It's progressive. That goes on for 3 weeks until the patient sees the surgeon in their post-op appointment. Once the surgeon clears them, that's when phase 2 of cardiac rehab occurs. Now, this phase can be based at home or at a facility. Typically, during this phase, patients can expect to be enrolled in an exercise program where they're using ellipticals, treadmills, the hand wheels to gain their upper body strength, a variety of exercise equipment. The benefit of this is that there is someone there that knows what they're doing. They are monitoring you for anything that could potentially become harmful, and you have support there. But it isn't just the exercise program. There is an interdisciplinary team, which includes your surgeon, your primary doctor, the exercise physiologist, dietitians, social workers. They're going to really help you understand the changes that you need to make. This includes dietary changes. A lot of cardiac patients don't understand that they shouldn't be pouring an entire thing of salt on every meal and shouldn't be drinking 6 cups of coffee a day. So these are all things that are necessary to alter, but a lot of people don't know how to go about doing that. So that's really a benefit of the cardiac rehab program. In the program, you're offered a lot of support from not only the staff, but also relationships are developed with your peers that are experiencing the same things. That's kind of where phase 3 comes into account. So phase 3, you're essentially done with the cardiac rehab program, but that doesn't mean that you are magically cured from heart disease. A lot of patients choose to utilize the outpatient facilities as a regular gym. They continue to develop their relationships with their peers, offer support to those who are coming in. This really leads to a positive experience, and we all know that if someone's happy, they're more likely to take care of themselves. added fact in case, heaven forbid, that anything happens, that there are healthcare providers nearby. So that's a really awesome thing for people to look forward to, because if you're diagnosed with a disease that is going to potentially impact you, you have to know that there's positives at the end of the tunnel. But with every positive, there's always a negative. Women and heart disease. We are all aware that it's a problem. The American Heart Association shares that 1 in 3 women are killed by heart disease and stroke yearly, but 80% of those could have been preventable. Women are less likely to be referred to cardiac rehab with heart disease progressions because it's not always the primary diagnosis. Women present differently when having complications. We think of a heart attack as crushing chest pain radiating to your left arm. Well, women typically complain of weakness, palpitations, nausea, loss of appetite. With there's just no significant history, heart disease isn't necessarily the first thing that is considered. Women are more likely to have stenosis rather than plaque buildup. And women present at an older age than their male counterparts. More discrepancies. When women are diagnosed with heart disease, it is encouraged that they are treated pharmacologically rather than a surgical plan. This is because a lot of physicians, according to Desaital, are presenting with symptoms that aren't consistent, so their diagnosis is delayed, thus leading to treatment being delayed. Ironically, once it is a problem, the first treatment is open heart surgery, which kind of defeats the purpose. But Emmenheiser and Reimer shared in their research that women are diagnosed later in life because of their decreased estrogen production. Because they're diagnosed later in life, they typically have a lot more comorbidities, diabetes, kidney issues. Keeping those factors in mind, if you have surgery and you're high risk, you're likely to have complications, leading to readmissions to the hospital, which is costly to both patient and hospital. But there was consideration that those women who participated in cardiac rehab did have a 45% reduction in readmission rates. But even with that being considered, women report more complications and barriers to treatment for the cardiac rehab program. They're more likely to report an issue with domestic role performance. There are more transportation issues, lack of support from their family. A lot of them are reporting that they are the caretaker of the family and there's no one to take care of them. Well, we can do better. How do we lower those discrepancies in treatment and referrals? There's so many ways to look at this problem. We have to get them to participate in these programs for their heart health and mental well-being too. A lot of consideration can be given to utilizing a specialized nurse practitioner that has special training regarding women's heart health. They can be trained to react proactively instead of reactively. And during those interactions, they will develop a relationship between the provider and the patient. It opens the doors to communication, allows for counseling opportunities, and the patients are more likely to engage in follow-up care. So another thing that the providers can consider is that not all rehab programs have to be in a facility. There are things available for all walks of life, including the American Heart Association 90-minute DVD that is provided for cardiac rehab patients. We are able to utilize things such as telemedicine if that's an option for the patients. Because of cardiac rehab being an interdisciplinary team, there's a lot of work with social work. So they have abilities to initiate and use transportation services. And most importantly, I think we could really encourage a lot more interaction and utilization if there was a specific discharge order set incorporated into our electronic medical record systems. That doesn't mean like when they're being discharged just from the hospital, but if a patient is diagnosed with a disease that is eligible for cardiac rehab, those patients should have that option to utilize the service. Through Healthy People 2030, the Million Hearts Initiative was developed. It really encourages maintaining a healthy heart. The primary goal of this one is for the cardiac rehabilitation change package. They know that there needs to be changes to it, so how are we going to institute those changes? There's a process improvement. First, there is the system change concept. That is a general notion that is useful in developing specific ideas. Hey, there's a problem, we need to fix it, which leads us to the change ideas, which are actionable, specific ideas to change the process of things. And then we have our tools and resources that are available to us. We want to increase enrollment and participation. Well, the baseline to do that is education. And one of the things that was strongly encouraged in my research was keeping an open door of communication between providers and patients, utilizing cost-effective methods such as phone calls and invitations and informational flyers. This is definitely something that we can consider. It's cost-effective and will reach a large amount of people. But that isn't the only thing. We have to increase people's enrollment in the program and encourage them to use it. The Genesis healthcare system has done several case studies and information packages that provides information to patient about each phase of the service, including their expectations, how everything's going to be, alleviating some of the worries from patients saying, I don't know what I'm getting into. The University of Alabama at Birmingham instituted a group orientation to the program where they focused on a mind and body concept to promote lifestyle changes. They gathered peer support, and that approach increased enrollment to cardiac rehab by 30% over a 3-year period. That's awesome. Those are things that we can do. And it's not that difficult to make the little changes in the programs to outweigh the negatives. These are positive things. So to increase the referrals, we have a few ideas. First and foremost, we need to facilitate conversations between the mid-level providers and the physicians. We need to understand that who is eligible, what can they do, what do these programs have to offer? Are these programs beneficial? Yes. Why aren't we using them? How can we use them? We can do that by implementing a protocol for outpatient referrals and the hospital discharge. If a patient is diagnosed with these problems, these diseases, there should be a pop-up in the order set that gives you the option to send them for cardiac rehab referral. If it pops up and you're going through it, you're likely to be triggered to say, hey, maybe that would be a good thing for us to consider. Also, a lot of follow-up correspondence. Once the patients are diagnosed with these diseases, it can be very difficult. It can feel very daunting, but keeping those doors of communication open is definitely a positive consideration. And again, we've been using telemedicine a lot more since COVID has happened, and I think that that really offers a benefit for a lot of patients that are experiencing issues with transportation or financial difficulties, anything. It's open. Again, it's just communication, open communication, education. We need to do that. And I think we can do better, and it seems pretty easy to enhance everything to do that. So Here's a list of my references that I have used. There's so much information out there. If you'd like any additional information, please let me know. I would be happy to share everything with you. And finally, have a good one. Thanks.